So May is Mental Health Awareness Month, and I wanted to talk a little bit about a subject that I get questions about all the time from my staff and from my students, which is how to refer clients out for mental health counseling if a therapist feels like that might be relevant to them. It's a touchy subject. A lot of therapists are super uncomfortable with it, but it's just really important to gain a little bit more comfort with that. So many of our clients come to us with varying degrees on a spectrum of some sort of mental health issues, whether it's just stress, which most of us deal with, which then maybe creates anxiety, which is a little bit more of an advanced form of stress, to much more severe things like PTSD and depression and other forms, bipolar disease. There are many things to be aware of. First of all, we're not mental health therapists or experts. Like, our job is definitely not to diagnose anything at all right? But if you're running into a client that is exhibiting some symptoms that may be relevant to some of those things, we see stress and anxiety all the time. We see potentially clients talking about depressive or avoidant behaviors. And certainly I see a fair number of people on my table who are exhibiting, low to medium to sometimes even more severe signs of PTSD. And I've gotten, over the years, very comfortable with just being able to say, hey, I noticed that this thing is happening. For instance, if I'm working on a muscle and I notice that there's like a nervous tic, I'll ask the client, hey, are you clenching up on purpose, or are you not aware that that's happening, right? And then most of the time will tell me, I'm not aware that that's happening, right? Maybe nothing. But I'll log that as, okay, that might be some level of PTSD involved. Maybe, maybe not. Again, I'm not a diagnostician, so that's not really my job. But it is worth noting these symptoms as they come up, talking with, and getting comfortable with a few things with clients. One, just plain asking them, have you considered, or are you working with a mental health professional on some of these things? Many of your clients are already doing that, and they'll just be able to say, oh yeah, I've got a therapist, it works for me, I'm working on this, that, and the other thing. Great, wonderful, right? If not, I have a whole list of people that I can give as references and resources for a client, and I can talk about my own experience with counseling if they need some support around just getting the idea under their head that it might be okay. I don't want to be pressury about it or try to be pushy, and offer it more as, well, I noticed these symptoms, you've come in for a few sessions and they don't seem to be changing much. Hopefully the major pain that you came in for is improving, but it might really benefit you to both work with me and a mental health professional. Because I see that some of these things might be more coming from up there, and your relationship with your own emotions and your relationship with boundaries around other people, than it is directly from, injury or overuse or how your body mechanics are. And those things can be very interrelated, right? Like, somebody who's got social anxiety is going to be self-protective, and they're going to roll into themselves in a certain way. And you can open that up in a session and make them feel really good until they go to a party or go to a new experience or meet new people, and that trigger happens again, and suddenly they're protecting and closing off again. That is in some ways beyond our scope of practice. We're not really able to do much other than point out that maybe that's a thing that might benefit from them working with somebody else. And notice that I'm using the word might a lot and being soft and gentle about it, as opposed to the you should go do this, right? Because that's not going to help them at all. So get some comfort for yourselves if you can. If you've not worked with a mental health counselor yourself as a massage therapist, I highly recommend doing it. I really try to work with all the different kinds of professionals that I might need to refer a client to, even if it's just to try a service out, whether it's Pilates or yoga or chiropractic or acupuncture. And I have done therapy, I've done life coaching and business coaching, and I've done varying forms of more mental focused services. So I have some experience enough to be able to share with a client that, you know, I've done it, it's been very supportive for me, it might support you, right? And then there are going to be those clients for whom that you will feel like every time you work with them, nothing really changes. And those for me really stick out as like, well, I could continue to work on them over and over and would be happy to do that if that's what they want and need. But I'm not going to be comfortable not confronting the elephant in the room, which is that they're not getting better. And that might not be me. That might just be that they need additional support that is beyond my scope of practice and just from a different modality that happens to be more emotional and intellectual and conceptual based than it is physiological. So, in honor of Mental Health Awareness Month, I invite you to think about that. If you're not comfortable with that concept, or you've never approached a client about it, or you don't know what to look for, I'll put some links below just so you can read up on common symptoms that might equal XYZ type of a disorder, or, you know, and know that everybody's on a spectrum, you know, whether it's anxiety or stress or depression, like, there are, you know, sort of the normal high functioning forms of those, and then there are the ones that are really disruptive to people's lives. Usually the people in those situations are pretty aware of their needs and are hopefully seeking help. The people that aren't so, you know, that are really high functioning might not really be aware that, yes, they are high functioning, and they could even be high functioning and feel good, which might be a way to enroll them, because that often is a choice that we make that we don't even realize. We can either be high functioning and not feel good and feel stress, or we can be low functioning and feel good, right? But there is actually a future for all of us in which we can be high functioning and feel great. And part of the reason that I'm mostly able to accomplish that in my life is that I have a regular session with my therapist every week. Not my massage therapist, I do that too, but my mental health therapist. So let me know in the comments below if you have any experience with this, if I missed anything, or if you want to add any tips, or even just the language around how you would speak to a client about this subject, because it's so touchy for us, and I really feel like it's so important for all of us to get a little bit more facility around both seeing the symptoms, noticing them, and pointing them out gently to a client in a way that supports them and allows them to find some relief.